Hi guys, welcome back to another interesting episode on Prime Health 360. Today we're going to be talking about stroke. Do you know that every 2 seconds someone dies of a stroke? I bet you didn't know that. And 1 out of every 6 people is likely to have a stroke. So it's best that we know the first signs of stroke, and that's what I'm going to be discussing with you in this video. My name is Dr. Kelly and you're welcome to Prime Health 360. Now let's talk about stroke. Stroke is when there's a blockage in the supply of blood to the brain cells. And this can happen when there's a blockage in the blood vessel or a burst in the blood vessels. Stroke is categorized into 3 categories. That's transient ischemic attack, ischemic stroke, and hemorrhagic stroke. The transient ischemic attack is also known as a mini stroke. This occurs when there's a temporary blockage in the flow of blood to the brain. It's temporary and it can be relieved on its own. It's usually caused by a blood clot and is a sign for a stroke to occur in the future. So please do not ignore a transient ischemic attack. The next type of stroke we'll be talking about is the ischemic stroke. Now, on very rare occasions, the heart doesn't contract as fast as it's supposed to, leading right to the formation of blood clots in the blood. These clots then starts moving through the blood vessels till it gets to a particular point that is too small for it to pass through. So when it gets to that point, it stops there and blocks blood flow from getting to that part of the brain, leading to a stroke. The next type of stroke we'll be talking about is the hemorrhagic stroke. This happens when there's a sudden burst of the blood vessels supplying the brain. This leads to pooling of blood in that particular area and also disrupting the perfusion of blood, the flow of blood to the brain, and also increasing of the brain's intracranial pressure. That is the pressure in the brain. The brain doesn't have pain receptors, so it's difficult for us to feel pain when there's something wrong with the brain. But rather, we get symptoms depending on the region of the brain that is being affected. For example, if the part of speech is being affected, we can end up having slurred speech. That is when somebody cannot pronounce some words very well. The person is dragging their words. Next symptom is hemiplegia or hemiparesis. In this situation, the person can't move one side of the body. The person complains of weakness in that part of the body. It could be the arm or the legs, or weakness in that particular part of the body. Another thing that can happen is death. Severe brain damage can lead to death, so we should be aware of it and get treatment in time. There are treatment methods used to treat stroke if only it's detected in good time. Tissue plasminogen activator is an intravenous fluid which, when passed into our body, helps remove every blood clot, melts out every blood clot in the blood vessel, allowing free passage of blood and free flow of blood into the brain tissue. Another way we can do it is thrombectomy. This is a procedure used to remove out every clot that is causing an occlusion, a blockage in the supply of blood to the brain. Now let's run through the first signs. F means face dripping. In this situation, you ask the individual you suspect has a stroke or you want to assess if they have a stroke. Ask the person to smile, and if you notice weakness on one side of the face, that means the person is smiling but the grain is not equal. That means one side has a grain, the other side doesn't, or has a weak grain. That is a sign of stroke. But if the person doesn't have it, the person is safe. Another way to assess it is through A, that is arm weakness. You tell the person to extend their arms. The person should complain of weakness in one arm, then that's a sign of stroke. But if the person doesn't complain of any weakness in the arm when it's extended like this, then it's fine. Another thing to assess for is slurred speech, that is S. If you're talking to someone and you find out that the person is dragging their speech or having a slow speech, that's a sign of stroke. It's called the slurred speech. And now it's time to take action. That is for T. T means time to take action. Call for help, rush the person to a hospital, because stroke is an emergency case and has to be treated in the ER, the emergency room. Now let's talk about those people who are at risk of having stroke. The first on my list to be advanced age. People above the age of 50 are at risk of having stroke. So they should endeavor to look out for the fast signs, which is the face drooping, arm weakness, slurred speech. And yeah, time to call for help. Second on that list would be genetics. If you have a family member who has a history of stroke, you are at risk of having stroke too. So please look out for the fast signs and do your routine checkup with your doctor. Or people who take a lot of salt in their meal. Salt is not good for the heart, salt is not good for the body. So if you indulge in fatty meals or take too much of salt, you are at risk of having a stroke. Next on my list would be men. Men are at risk of having stroke, although women die more from stroke. But according to research, men have a higher risk of having stroke. So if you're a man and you get to a particular age, please check for the fast signs and please do see your doctor for your routine checkup to avoid having a future stroke. Next on the list will be inactivity. When we don't do exercise, the lack of exercise, sedentary lifestyle can lead to us having a stroke. As I said, on rare occasions, the heart can stop pumping blood, and that can lead to production of clots in our blood vessels, which can lead to an ischemic stroke. So we should try and be exercising ourselves. Let's stay active, keep our heart pumping, keep our heart beating fast, so to avoid us from having stroke or putting ourselves in the risk of having a future stroke. And finally, lifestyle. Excessive alcohol intake and smoking can predispose us to having a stroke. So let's learn to drink in moderation and quit smoking in order for us not to have a future stroke. That being said, hope I've provided valuable information that will make us to stay healthy and prevent us from having stroke. To sum it all up, let us quit smoking, drink in moderation, live a healthy lifestyle, keep our weights down, and we should get our routine checkups. If you suspect that you have a sign of stroke, please do see a doctor. Stroke is a medical emergency and is to be treated with urgency. Do subscribe to our YouTube channel and hit the notification bell so you'll be notified whenever we upload a new video. Follow us on our social media platform and do visit our website www.primebusiness.africa. I remain your host, Dr. Kelly, and until our next episode, this is Prime Health 360.